When I was brought up, yes, death was a taboo. Death is something about sadness, about not able to see the person again. You don't talk about it. But today, people are able to speak more openly about it.
Palliative care is a supportive care of someone who has just been diagnosed with serious illness and is needing support of various types, whether it is to access services, access treatment, or even just emotional support. The Singapore Hospice Council was initially a ground-up movement that involves volunteers, and over time we have grown to an umbrella organisation that represents 25 different institutions or agencies who are actively providing support to patients and families with palliative care needs. So it consists of service providers, educational as well as research organisations who very much want to bring the best quality care into this space.
The Singapore Hospice Council continues to be committed to partner various clinical teams and work groups to assess and improve the quality of palliative care in Singapore by working together to innovate best practices and introduce new models of care. The Singapore Hospice Council also organises workshops, webinars and conferences such as the biannual Singapore Palliative Care Conference. In fact, this is a conference that allows healthcare professionals to come together to engage, network, as well as to learn more about palliative care.
The data has shown that between being referred to palliative care to a patient passing away, for cancer patients it's about a month plus minus. For non-cancer patients it's a mere 2 weeks or less. It's just too short a time. In order to close this gap, we are ramping up public education, community engagement for us to really share the benefits of palliative care. So we are running Palliative Care 101 course to tell people what is palliative care, who is it for, when can you ask for it, to really make that as an option for people to choose, empowering them. The aim is to really set up community signposts in every constituency in 5 years, to do the outreach and to have people really talk about it, to normalize conversations.
As the chairperson of the Singapore Hospice Council, I intend to promote and strengthen awareness about the matters around dying and death in Singapore. I would like to have the general public be more accepting of dying and take the initiative of taking matters about dying into their own hands. In particular, they could address issues how to prepare for death. I would also like to position Singapore as a leader in hospice and palliative care in the region, because there are many things that we've been doing recently and pioneer here that we could share with our neighbouring countries.
Because we could never know when it's time to go, and it is an uncertainty that we see all the time, it is important for us to then live every moment as well as we can to ensure that when it's time to go, we are all ready.
Aspire to inspire before you expire. Live in such a way with enthusiasm, how you influence others before you die.
To be at peace at the end of life, to have all the wishes accomplished, and to be symptom-free, and to die in the presence of your loved ones. To me, I think that is a good death.
Living before leaving.
Living before living.
Living before leaving.
Living before leaving.
Living before leaving.